Hey guys, welcome back. Today we are going to discuss about pulmonary embolism, nursing diagnosis and care plan. So what is pulmonary embolism? It is a blockage of one or more pulmonary arteries by a blood clot. Large emboli obstruct pulmonary blood flow, causing reduced oxygenation, reduced gas exchange, pulmonary tissue hypoxia, and even death. Most pulmonary embolisms occurs due to deep vein thrombosis in the lower extremities, and when a thrombus breaks off and travels to the lungs can lead to pulmonary embolism. So now we will see uh, uh, the nursing diagnosis and care plan. So before that, the nurses should assess the following things before writing the nursing care plan. They are dyspnea, chest pain, mental status changes, pain in the lower extremities, bluish discoloration of the skin, and also they have to document it. Dyspnea, chest pain, mental status changes, pain in the lower extremities, bluish discoloration of the skin. Also, we have to consider these 8 characteristic features, and if the patient is coming under or comes under these any of these characteristic features, they are known as high risk patient. That features are age 50 or older, rapid heart rate, oxygen saturation is not normal, hemoptysis or coughing up blood, hormone replacement or oral contraceptive usage history, prior deep vein thrombosis or pulmonary embolism history, unilateral leg edema, surgery or trauma within the previous 4 weeks. So the nurse should consider all these factors and need to find out these factors before writing the nursing care plan and diagnosis. Now we will see the nursing diagnosis. First nursing diagnosis is impaired gas exchange related to ventilation perfusion mismatch as evidenced by oxygen saturation of 85%, dyspnea on exertion, and use of accessory muscles for breathing. Sometimes your patient will not show all these symptoms, whatever the things you have observed that you can write after as evidenced by. Second thing, decreased cardiac output related to increased pulmonary vascular resistance as evidenced by blood pressure variation, tachycardia, and weak peripheral pulses. So that is the second nursing diagnosis. So we'll repeat, impaired gas exchange related to ventilation perfusion mismatch as evidenced by oxygen saturation abnormality, dyspnea on exertion, and use of accessory muscles for breathing. Second one, decreased cardiac output related to increased pulmonary vascular resistance as evidenced by blood pressure variations, tachycardia, and weak peripheral pulses. Next nursing diagnosis is acute pain related to pleuritic chest pain secondary to pulmonary embolism as evidenced by patient's verbal report of pain. Next one, anxiety related to hypoxia and fear of death as evidenced by restlessness, verbal expression of fear. Next one, wrist for bleeding related to anticoagulant therapy, and there is no acid evidence to by because they describe a potential problem. So these are all the nursing diagnoses you can write for pulmonary embolism. And now we will see the nursing care plan. While writing the care plan, always write like this in columns: assessment, diagnosis, planning, rational, implementation, and evaluation. In assessment, you have to write subjective data and objective data. Subjective data means what the subject is saying about the situation. Who is subject? Patient is subject. Objective data means what you have observed from the situation of the subject or from the patient. And in diagnosis column, you have to write diagnosis and goal. The patient will maintain. It will be in future tense because it is a goal. Through the plans, you will achieve the goal. Then planning will be in present tense, and rational, it is better to start with to, and implementation will be in past tense. And while writing the evaluation, you have to compare your evaluation with the goal and you have to write. Now we will see the nursing diagnosis for impaired gas exchange related to ventilation perfusion mismatch. The subjective data is the patient complains that he or she is having breathing difficulty. What objective data is the patient looks dull and tired and vital signs are fluctuating. Then you have to write the diagnosis. Then goal. The patient will maintain adequate oxygenation as evidenced by oxygen saturation greater than 92% and normal respiratory rate. Then while coming to the planning, first one, monitor the respiratory rate, rhythm, and oxygen saturation. Rational to understand the condition of the patient. Implementation, monitored and recorded. Second one, administer supplemental oxygen. to reduce the breathing difficulty. Administered supplemental oxygen. Then position the patient to improve breathing. Position the patient from semi-Fowler's position to high Fowler's position. In implementation, you have to describe what type of plans you have implemented. That would be really good. Will be more effective and that enhance the credibility of your writing. Then encourage deep breathing and use of incentive spirometer. Incentive spirometer is a machine that is using to support breathing. So in this image, you can see how incentive spirometer looks like. So encourage deep breathing and use of incentive spirometer rational to improve the lung expansion. Then implementation, encouraged and monitored the use of incentive spirometer. Then in evaluation, patient's oxygen saturation is greater than 92% and reduced respiratory distress. All right. So this is, as I said, this is an image of incentive spirometer. Next nursing diagnosis is decreased cardiac output related to increased pulmonary vascular resistance. Subjective data, the patient says that he or she is feeling tired, giddiness and breathing difficulty. Objective data, there is evidence of irregular vital signs. Patient is tired, dull and their skin was cold and signs of tachypnea. Goal, the patient will maintain stable hemodynamic status. That means the blood pressure, heart rate, etc. Then, while coming to the planning, monitor vital signs closely. For what to understand the condition of the patient. Monitored, and what you have monitored, BP, oxygen saturation, heart rate, etc., that you can write there. Then next planning, assess for signs of right side heart failure. It's very, very important for what? To avoid the complication. So how we can assess the right side heart failure means you have to assess jugular vein distension, edema, etc. Then administer anticoagulants or thrombolytics medication as per the order of the physician or the doctor to improve the situation of the patient. Administered and documented. Then maintain IV access for emergency medication because there are chances of heart failure and all. Then so you definitely have to maintain IV access for emergency medication. Rational to avoid complication. Implementation, maintain the IV access for emergency. And what could be the goal? The patient maintains stable hemodynamics such as BP, heart rate, absence of signs of shock or heart failure. All right. This is second nursing diagnosis, decreased cardiac output related to increased pulmonary vascular resistance. Next one, acute pain related to pleuritic chest pain secondary to pulmonary embolism. Subjective data, the patient complains that he or she is feeling pain in the chest. Objective data, the patient looks restless, tired and dull. In pain scale, the pain is 7. That means very severe pain. The goal, the patient will report reduced pain level within 30 to 60 minutes of intervention. Then planning, do history collection and physical examination to understand the general condition of the patient. Done history collection and physical examination and recorded. Second one, assess pain characteristic features. For what? To find out the solution. Assess the pain, location, severity and quality. Next, administer prescribed analgesics. Rational to enhance comfort and reduce complications. Implementation, administered medication as per the order. Then next planning, encourage the patient to splint chest while coughing or breathing deeply. To reduce pain and increase comfort, encourage the patient to use splint chest while coughing and advise to do deep breathe. So what is splint chest? So here you can see what is splint chest. So supportive devices. Okay, so while breathing, this device, I mean this measure or instrument will give some support to the chest. Then evaluation, patient reports pain less than 3 on a 0 to 10 scale. All right. Then next is anxiety related to hypoxia and fear of death. Subjective data, the patient says that she is feeling fear and tension all the time. Objective data, the patient looks very agitated and scared. And the goal, the patient will verbalize, reduce anxiety and demonstrate effective coping strategies. Planning, remain with the patient and provide reassurance. For what? To improve the confidence level of the patient, remain with the patient and provided reassurance, explain procedures and treatment clearly. To improve the knowledge and comfort, explain the procedures clearly, provide calm and quiet environment. To reduce the use of physiological demand of oxygen, provided a calm environment with less noise. Encourage expression of fears of concerns. To help the patient to communicate the feeling, encourage the patient to talk. Evaluation, the patient appears calm, asks question and reports feeling less anxious. All right. Next, nursing diagnosis is first for bleeding related to anticoagulant therapy. Subjective data. Patient states, I bruise easily since starting this medication, or the patient reports feeling dizzy or lightheaded. And in objective data, you can write prolonged bleeding from the injection site and also observe nose bleeding or gum bleeding during the oral examination. Then diagnosis, risk for bleeding related to anticoagulant therapy. Goal, the patient will remain free from signs of active bleeding. Planning, monitor vital signs, especially blood pressure and heart rate, because hypertension and tachycardia may indicate internal bleeding, then monitored and recorded in implementation. The next planning, inspect the skin and monitor the lab values. To reduce the complications, inspected the skin and check the lab values. Educate the patient to avoid activities that may cause injury. To prevent trauma, educated the patient in detail. Then instruct the patient to use soft bristle toothbrush and avoid flossing vigorously to prevent bleeding and blood loss. Instructed to use soft brush. Then encourage the patient to report any unusual bleeding to prevent the complication. Encourage the patient to report it and give an emergency number. Maintain fall precaution to prevent trauma. Maintain fall precautions. And the goal will be patient will remain free from signs of bleeding. Then what would be the evaluation? Patient is free from the signs of bleeding and there is no evidence of bleeding. So this is about the nursing diagnosis and care plan for pulmonary embolism. Thank you guys. Next time with other nursing